When we think about innovation in public health and how we transform public health, and who might be pushing the envelope in creating new ways to create a healthier America, the New York City Department of Health, and it's the Department of Health and Mental Hygiene, is always one of the first places that comes to mind. Especially in the area of chronic disease prevention, New York has been aggressive, some would say combative, and always ahead of the curve, and certainly always making waves, and waves that push the rest of us, I think, to be more creative in the work that we do. That's been possible in part because of the political leadership in New York City, political leadership that really gets public health. It's also because the health department for many years now has had very effective and very creative leadership. But it's also because of people like Dr. Lynn Silver, who's been a national trailblazer and working with little public recognition to make lives healthier in New York and setting models for us around the country. So we are glad to honor her today. This was a stiff competition, so it wasn't easy, but we're delighted that Lynn is the clear winner. And we also want to thank both Michael Jacobson from the Center for Science and the Public Interest and Dr. Mary Bassett from Doris Duke Charitable Foundation for actually nominating Lynn.
Good afternoon. Thank you, Jeff. This is truly an honor. I thank the foundation, its board, the selection committee for recognizing our, and here the operative word is our, work to prevent chronic disease in New York City. 8 years ago, I was sitting in my apartment in Stockholm where I was teaching at the time. My phone rang and there was this very fast voice with a New York accent at the other end, Sarah Pearl, and she said, "We got your CV. Would you like to work for us preventing chronic disease?" And my face fell and I said, "That wasn't the job I applied for. I don't know anything about chronic disease." But a couple of months later, I was coming to DC and I said, what the heck, I'll go up to New York and talk to them. And one thing became very quickly clear. These were a group of people who were very serious about public health. Dr. Mary Bassett, who had spent her life working in Africa and had come back home, and a guy named Tom Frieden, who I had last seen in 1984 as a medical student in the city, had already implemented a courageous smoke-free air policy in the city, and I could breathe wherever I went. So I took a deep breath of this clean air and said yes, and came home and was given something of a blue sky task. Figure out how you can prevent chronic disease in a city of 8 million people. One thing was immediately clear, which was that we weren't going to get far trying to do it one by one. In contrast, New York City had led the way in urban public health by rethinking what it meant to be a city, organizing safer housing, clean water supplies, parks, and street cleaning over a century ago. Our health code was a housing code before it was anything else, and we regulated food supply safety by 1870. It was clear from the exploding epidemic curves of obesity and diabetes that we needed a similar kind of environmental public health action that the department had so successfully championed to vanquish epidemics past. So I rolled up my sleeves and tried to find some people who were smarter than me, and talked to a lot of other people, and tried to imagine how we could do this. We invented new ideas and stole as many good ones as we could possibly find. The trans fat ban was, like New York City's ban on lead paint, which led the nation, a dangerous substance that was fully replaceable. And just like lead in paint, nobody is missing it today in New York. You can still eat cannolis. Denmark had this idea before us, so thank you, Denmark. We stole the idea from them. And I thank Professor Walter Willett of Harvard University, who was really the first to call our attention to the issue. He said, "This is a problem, you should look at it," to Dr. Coke McCord, my predecessor. Of course, we had to figure out how to do it. The calorie labeling law, in turn, which New York was the first to put into practice, actually owed its origin to Representative DeLauro and Senator Harkin, who had introduced it in Congress some years before. Our efforts to regulate the food, physical activity, and screen time environment in childcare and public food procurement were homegrown. The National Salt Reduction Initiative was the product of decades of scientific work from around the world, but also stolen from the experience of our colleagues in the United Kingdom, and then our own adaptation here in the United States. In summary, we sought to put together a vision of a new food safety for the 21st century that goes beyond the traditional and still challenging world of preventing bacteriological illness to one where preventing our society's main killers through better nutrition is also a priority. But none of this could have happened without an extraordinary cast of characters, and you're going to have to put up with a few more thank yous. First, to New Yorkers who consistently demonstrated in the polls and in the voting booth and in their creation of a strong and independent Board of Health 2 centuries ago that they wanted government to assure a healthy food supply and physical environment. Next to Mayor Michael Bloomberg, without whose exceptional, deep, personal commitment to public health, none of this would have been possible. Then Commissioner Thomas Frieden, who now has a new job, was dedicated, tireless, and demanding of high quality. But when you came to him with a good idea, he offered sound judgment and advice, and was utterly fearless in putting himself out on the line to advance good public health. Dr. Mary Bassett offered her sound experience, good judgment, keen scientific mind, and sharp pen to these measures. My incredible staff and colleagues from around the department were indispensable. Candace Young called my attention to the menu labeling idea. Her successor, Kathy Nonis, helped implement our guidelines on daycare and calorie labeling, and numerous other measures. Gail Goldstein, Sonia Angel, and Christine Johnson, our cardiovascular SWAT team, was instrumental in putting together the trans fat ban and the National Salt Reduction Initiative, and our food procurement guidelines. Our food safety and child care inspectors shared their knowledge and experience in the field. Wilfredo Lopez, our general counsel of 25 years, now emeritus, and his successor, Thomas Merrill, guided us through legal mazes and safely navigated us through the courts when we had to go there. Our communications teams kept us talking to New Yorkers, and colleagues from the scientific community like Lawrence Appel, Dariush Mozaffarian, Barry Popcorn, and Kelly Brownell, and from the legal community, Maris Ash, Stephen Sugarman, Doug Blanke, who's here tonight, Deepak Gupta, William Schultz, and others, gave us their wisdom, were generous with their time and their assistance to help create these innovative experiences in New York. Doctors Michael Jacobson and Margot Wootan from the Centers of Science and the Public Interest had been building advocacy around these critical nutrition issues for decades before New York got to them. Thank you. Dr. Thomas Farley, our current commissioner, provided intellectual input and support and is a passionate advocate for a healthy food supply and continuing these efforts. The American Institute of Architects and Karen Lee and Commissioner David Burney helped build our work on the built environment and the New York City Active Design Guidelines. And our Department of Education worked incredibly hard to serve 800,000 healthier meals a day and actually listened to our endless and tiresome suggestions on things they should change. And New York City taxpayers, of course, along with a number of foundations, RWJ, New York State Health Foundation, NIH, Kresge, and others have helped out financially. A long time ago when I was a student at Hopkins, Professor Susan Baker showed a slide with a very simple concept. It was about the effectiveness of public health measures in relation to the number of individual human decisions that needed to be taken. It used a straightforward example, a water heater with a set limit to prevent burns, versus every household having to reset the gauge. The slide still bounces around in my mind and has been a constant companion over my career. It reminds me always that it makes a lot more sense, if you can, to change the default than to ask 8 million people to do something every day, like ask the waiter about trans fat in their food. So thank you, Dr. Baker. Many people are unmentioned, but I thank you all. None of this was accomplished alone, and all of our very large team should share in the recognition. Last but not least, I want to thank my daughters, Isadora and Isabel, who put up with many late dinners, long nights at the computer, and grumpy days during lawsuits, and my new husband, Don, who I hadn't met yet, but who will be with me for the next battles. Thank you for your love and support, all. Summing up, in New York, life expectancy is increasing faster than the nation. Our children are getting somewhat healthier. Smoking is amongst the lowest rates in the nation. Sugary drink consumption is falling. Biking is growing. You can still buy a hot dog or salt your fries or get a smoke, and we're not going to make that impossible. But you'll probably live to see your grandchildren, and we think that matters to people. So I hope my public health colleagues and politicians take heart from our experiences in New York City and from the strong public support that it has had across political and social class lines as they move forward trying to create healthier communities. We shouldn't be afraid to envision the world around us differently, to make waves. The combination of wave making and hardworking rocks in the pond has been the proud history of public health. Thank you.